How do sedatives help with PTSD-related sleep problems? Imagine lying in bed, desperately trying to fall asleep, but your mind keeps replaying traumatic memories or nightmares. Sleep issues are common in PTSD, making recovery even harder. Some medications called sedatives are sometimes used to help manage these sleep problems, but how exactly do they work? Let's explore this carefully and factually. PTSD often disrupts sleep in many ways. People might find it hard to fall asleep, wake up frequently, or experience intense nightmares. These disturbances can make daytime symptoms worse and affect overall well-being. While psychotherapy like cognitive behavioral therapy for insomnia is the first choice, medications can sometimes provide relief when needed. One medication often used is prazosin. It is originally an antihypertensive drug, which means it helps lower blood pressure. Prazosin works by blocking certain receptors called alpha-1 adrenergic receptors. In PTSD, the body's stress response can stay heightened at night, leading to nightmares and restless sleep. Prazosin helps reduce this overactivity, which can decrease the frequency and severity of trauma-related nightmares. Many people report fewer nightmares after taking prazosin, and some see improvements in overall sleep quality. It is generally well tolerated, but because it can lower blood pressure, it needs to be started at low doses and carefully increased under medical supervision to avoid dizziness or fainting. Other medications that are sometimes prescribed include traditional sleep aids like benzodiazepines and non-benzodiazepine sleep medications. These drugs mainly help with falling asleep and staying asleep but do not specifically target nightmares. They can be effective in the short term but are usually not recommended for long-term use because they can cause dependence, tolerance, and side effects. Some antidepressants are also prescribed because they can help with both mood and sleep, but their primary purpose is not sleep aid. Clonidine is another medication sometimes used. It is also a blood pressure medication that acts on alpha-2 adrenergic receptors. Clonidine may help reduce nightmares and improve sleep by calming the nervous system and possibly altering sleep patterns during REM sleep, which is when most nightmares occur. However, evidence for clonidine's effectiveness is limited, and it is not considered a first-line treatment. It is very important to remember that the main recommended approach for sleep problems in PTSD is psychotherapy, especially cognitive behavioral therapy for insomnia. This therapy helps change negative thoughts and behaviors around sleep, leading to long-lasting improvements without medication risks. Combining therapy with medication can be helpful, but medications should always be used under the guidance of a healthcare professional. While sedatives and sleep aids can provide relief, they are not cures. They come with potential risks like side effects, dependence, and interactions with other medicines. They are usually considered when therapy alone does not fully resolve sleep issues or when symptoms are severe. Always discuss these options with a healthcare provider to find the safest and most effective plan tailored to your needs. Research into medications for PTSD-related sleep problems continues. Some studies show mixed results, highlighting the importance of personalized treatment. What works well for one person might not work for another, so ongoing monitoring and adjustments are key. For anyone experiencing sleep problems with PTSD, a comprehensive approach is best. This includes prioritizing evidence-based psychotherapy, considering medication options if necessary, practicing good sleep hygiene like maintaining a regular sleep schedule, and avoiding alcohol, caffeine, or screens before bed. Creating a restful sleep environment can also make a big difference. In summary, sedatives and sleep aids can help manage PTSD-related sleep issues, especially nightmares, but they are not a standalone solution. Combining therapy with medication when appropriate, and always under medical supervision, offers the best chance for better sleep and improved quality of life. Remember, always consult a healthcare professional to discuss your specific situation and find the safest, most effective treatment options.